Hi, my name is Michael Benoit Prede, and I'm talk about hydroxyurea for children with sickle cell anemia, a signature of medical English. In the introduction, we have hydroxyurea is an effective treatment for sickle cell anemia, but few studies have been conducted in sub-Saharan Africa, where the burden is greatest. Pre-existing conditions such as malnutrition and malaria may affect the feasibility, safety, and benefits of hydroxyurea in low-resource settings. What is sickle cell anemia?
Sickle cell anemia is a genetic disease that affects hemoglobin, the oxygen transport molecule in the blood. The disease gets its name from the shape of the red blood cells under low oxygen conditions. Some red blood cells become sickle-shaped, and these elongated cells get stuck in small blood vessels so that parts of the body don't get the oxygen they need. Sickle cell anemia is caused by a single letter change in the DNA. This in turn alters one of the amino acids in the hemoglobin protein. Valine sits in a position where glutamic acid should be. The valine makes the hemoglobin molecules stick together when oxygen tension is low, forming long fibers that distort the shape of the red blood cells, and this brings on an attack.
Affects quality of life and may lead to death, usually slow. In the methods, we enroll children 1 to 10 years of age with sickle cell anemia in 4 sub-Saharan countries. Children receive hydroxyurea at dose of 15 to 20 milligrams per kilograms of body weight per day for 6 months, followed by dose escalation. The end point assists facility enrollment, retention, and adherence safely. Dose levels, toxic effects, and malaria and benefits like laboratory variables, sickle cell related events, transfusions, and survival.
Hi, my name is Dr. Alicia Nero. I am a hematologist in the Sickle Cell Program at Children's Medical Center and UT Southwestern Medical Center. I want to tell you about a medication called hydroxyurea. You may have already heard about it, but we're using this video to spread the word. Hydroxyurea is the only medicine that can prevent problems in people with sickle cell disease, and that's in both children and adults. Hydroxyurea is taken by mouth once daily, and in people with sickle cell anemia who take this medicine, it has been shown to greatly decrease the number of pain crises, as well as decreasing acute chest syndrome, which is a severe lung problem similar to pneumonia. It also decreases hospital admissions and the need for blood transfusions. In addition, it improves the anemia associated with sickle cell disease and improves the quality of life. Importantly, adults who take hydroxyurea live longer than those who do not. Hydroxyurea has been studied in people with sickle cell anemia of all ages, including babies as young as 9 months. It appears to be both safe and effective. You may wonder why, if hydroxyurea is so great, are we not just giving it to everyone? Well, in fact, the Sickle Cell Program at UT Southwestern and Children's Medical Center Dallas is interested in expanding the use of hydroxyurea, and we're beginning to suggest it to most patients with sickle cell anemia. However, there are some minor side effects from hydroxyurea that you will need to know about. We will go through those in detail in your clinic visit.
I chose to start the hydroxyurea regimen because he was in the hospital constantly, month after month. I started because last year in March, I came down with acute chest syndrome. And for any persons living with sickle cell disease, you know that acute chest syndrome is very, very, very scary.
My child Trevorius has been taking Droxyl for about a year and a half now. I choose to start it because they gave me some information about it, so I researched it a bit more, and then once I finished researching it and I found out that it was going to be better for him, I decided to take a chance on it. I'm glad I did.
My son has been on hydroxyurea for about 10, 13 years.
For us as young parents, not knowing what's going on with our child and him always in the hospital hurting until we came across the hydroxyurea, and it's definitely, like I said, decreased the amount of crisis dramatically, and it's kind of like a miracle almost.
Hydroxyurea has allowed me to keep my business. I have been out of the hospital and healthy since July of last year. It has been.
In the results, a total of 635 children were fully enrolled. 606 children completed screening and began receiving hydroxyurea at a mean dose from 70.5 and 1.8 mg per kilogram per day. The retention rate was 94.2% at 3 years of treatment. Hydroxyurea therapy led to significant increase in both hemoglobin and fetal hemoglobin levels. Those limiting toxic events regarding laboratory variables occurs in 5.1% of the participants, which was below the protocol specified threshold for safety. During the treatment phase, 20.6 dose limiting toxic events per 100 patients years occurred, as compared with 20.7 events per 100 patient years before treatment. As compared with the pre-treatment period, the rates of clinical adverse events decreased with hydroxyurea use, including rate of vaso-occlusive pain. And in the conclusion, the hydroxyurea treatment was feasible and safe in children with sickle cell anemia living in sub-Saharan Africa. Hydroxyurea used to reduce the incidence of vaso-occlusive events, infections, malaria, transfusions, and deaths, which support the need for wider access to treatment. The hydroxyurea and sickle cell. Starting by the Tamika Monsley Sickle Cell Natural Healing.
Hi YouTube, it is Sickle Cell Natural Healing, and today I have been asked to do a video on hydroxyurea, even flow, and chlorophyll dealing with sickle cell disease. Now, I have a lot of people who ask me, I'm giving my child hydroxyurea, can I give my child even flow? Even flow is just food, that's it. At the end of the day, it is strictly a food supplement. So the answer is yes, you can give your child even flow along with hydroxyurea. Now, the question I ask them is, okay, we know that hydroxyurea is a very strong cancer medication. We know, and we can look this up on the internet. You can Google hydroxyurea side effects if you want more information. We know that it has pages and pages of horrible side effects. We know that it can actually cause cancer. We know that it can mess with the bone marrow. We know that it can actually damage your organs down the road if we continue to take this long term. It's a cancer drug, okay? So we have to first of all know what we're putting into our child's body.
And that is a conclusion. I hope you enjoyed the video. Thank you very much. See you soon.